fertility consultant, GarbhaGudi IVF Center, Jayanagar. So many women has this complaint or doubt, what should we do if we encounter bleeding during pregnancy, especially through IVF treatment. So how common it is, what should we do, what care should we take during pregnancy to avoid this bleeding? Yes, this is one of the most common complaint or complication we come across, especially in the early pregnancy, that is first 3 months of pregnancy. In any mode of conception, let it be natural conception, IUI conception or IVF conception. But when we have taken IVF or higher treatment, when we encounter even a small amount of bleeding or spotting, women will get very anxious. Why it is happening? I'm already on so many medications, why still I'm getting spotting or bleeding? Yes, how commonly we see this is in 25% to 30% of the women. If I see 100 women, 25 to 30% may encounter spotting or mild bleeding in the first 3 months of pregnancy. But again, depends upon the intensity, severity or frequency, how often it is happening, so that how or what care should we take. If it is happening once in a while, only minimal spotting without any other major complaints along with that, like there is no pain, significant pain or significant bleeding is not there, then in the scan also the baby is growing fine, there is no bleeding in the scan, then to some extent yes, with medications we can control. So when you encounter there is a bleeding in pregnancy, especially in the early pregnancy, immediately you have to inform your consultant or the fertility specialist that you are having this complaint. So the doctor can address the issue as soon as possible. So what commonly we do is, when a woman comes with any bleeding issue in the first 3 months, we do the scan and see, is there any bleeding inside the uterus also, in the baby bed also, where the baby implants, we call it as decidual reaction. So if there is a bleeding beneath this, we call it as subchorionic bleed. So how large the subchorionic bleed is it covering more than 30% of the baby sac, then it becomes significant. If it is covering less than 30%, if it is only 10%, 15%, then we say please be at rest, take the medications, we start them on progesterone supplements, and we stop blood thinners. Sometimes with the blood thinners also women encounter, because when the women has taken IVF treatment, we oftenly put them on blood thinners to increase the blood circulation to the uterus. But in pregnancy, some women, because of that, they may encounter increased risk for this bleeding. So we will be stopping the blood thinners immediately, increasing their progesterone support and the complete bed rest. This will be the prophylactic management when we see the bleeding, or we see the bleeding in the scan also, or the woman is complaining the bleeding. So rest again, increasing the progesterone support, stopping the blood thinners will be our primary management. Also we add some medications to stop the bleeding like tranexamic acid, and also keeping if the severity of the bleeding is low, more than 30% of the sac is covered by the blood clot, or actively women is bleeding without not responding to the medications, then we keep the women in the in-house, we give injectables to stop the bleeding, we monitor how she is responding to the medication. So first and foremost is, don't be anxious, be aware this complication can happen in up to 25 to 30% of the women. Based on your severity, we will be deciding whether you need admission or not. Most basic thing is being at rest, avoiding exertion, physical activity, sexual intercourse, taking the proper medications on time. Thank you.